Good evening, everyone. My name is Hannah Johnson, and tonight's lecture is going to be about meningitis. What is meningitis? Meningitis is the inflammation of the membranes surrounding your brain and spinal cord. Most cases of this type of disease in the United States are caused by viral infections. Seek immediate medical care if you suspect someone has meningitis. Early treatment of bacterial meningitis can prevent serious complications. Symptoms of meningitis. There are many symptoms that people may have when it comes to meningitis. Those symptoms consist of sudden high fever, seizures, stiff neck, nausea, headache, no appetite, and skin rash. Other symptoms that people may not know they have with meningitis are confusion or difficulty concentrating and sleeplessness or difficulty waking. Signs of meningitis in newborns: constant crying, high fever, poor feeding, stiffness in a baby's body and neck, and excessive sleeplessness. Causes of meningitis. Viral infections are the most common cause of meningitis, followed by bacterial infections and rarely fungal infections. There are different types of meningitis. The first type of meningitis is bacterial meningitis, which is bacteria that enters the bloodstream and travels down the brain and spinal cord. The second type of meningitis is viral meningitis. It is usually mild and clears on its own. Types of viruses such as herpes, HIV, mumps, and West Nile virus are the ones that cause viral meningitis. Chronic meningitis is the next one. It invades the membranes and fluid surrounding the brain. Fungal meningitis may mimic acute bacterial meningitis, not contagious from person to person. Other meningitis causes can result from non-infectious causes such as chemical reactions, drug allergies, and some types of cancer, inflammatory diseases such as sarcoidosis. Next. Diagnosis of meningitis. Family doctor or pediatrician can diagnose meningitis based on your medical history, a physical exam, and a certain diagnostic test. During the exam, your doctor may check for signs of infection around the head, ears, throat, and the slur along the spine. You and the child may undergo the following diagnostic tests, and they are blood cultures, imaging, and spinal tap, known as lumbar puncture. Complications of meningitis. Meningitis complications can be severe. As long as you and your child has the disease without treatment, the greater risk of seizures and permanent neurological damage, including hearing loss, brain damage, shock, death, learning disabilities, kidney failure. Patients with severe meningitis can have a good recovery with proper treatment. Prevention of meningitis. Common bacteria or the viruses that can cause meningitis could be spread through coughing, sneezing, kissing, or sharing eating utensils, a toothbrush, or cigarette. Steps to take to prevent meningitis. Wash your hands, which prevent the spread of germs amongst others that are around you. Practice good hygiene. Never share drinks, food, straws, and lip balms. Always teach your child to avoid sharing their items with others. Stay healthy. Get enough rest, exercise regularly, and eat a healthy diet to keep your immune system up. Cover your mouth. When you go to sneeze or cough, make sure to cover your nose and mouth with something so that you won't spread anything. If you're pregnant, take care with food. Avoid foods such as cheese that is made from unpasteurized milk. Look for labels that is clearly made from something that is good to eat, such as meat, hot dogs, and daily meat. Treatment of meningitis. Antibiotics can't cure viral meningitis, and in most cases, it may improve on its own in several weeks. Treatment of mild cases of viral meningitis usually includes bed rest, plenty of fluids, and over-the-counter pain medications to help reduce fever and relieve body aches. Risk factors of meningitis. First risk factor of meningitis is skipping vaccinations. When you skip the schedule of doing the vaccination, you have higher risk of getting meningitis. The second one is age. Occurs mostly in children under the age of 5. People under 20 years of age have a common of getting bacterial meningitis. Living in a community setting. People in college dormitories, building schools, and military bases are at greater risk of meningococcal meningitis. Bacteria spread by the respiratory route and spreads quickly through large groups. Pregnancy increases the risk of listeriosis, which may turn out to having a miscarriage, stillbirth, or premature delivery. And the last one, compromised immune system. When it takes to taking drugs or having diabetes, it still don't take the fact of getting susceptible to meningitis. And that concludes my lecture on meningitis. This is my buddy Darian and my sister Abby. Hope you all enjoyed my lecture. Thank you.